So a typical day for me, I work in an inner city practice. So I will normally go in, say good morning to the team, make sure everything is okay and everybody is fine. When I get to my office, I will look at my admin tasks and see if there's anything urgent that needs doing, such as a referral, or if there's registration documents to bring into our system. I check my emails and just see what's coming overnight. Sometimes it can be quite busy with emails. We get quite a lot of information through from the local health boards. We also work collaboratively with lots of different teams. So I may have an email from Health Inclusion asking me to arrange an appointment for somebody, or I may have an email from Place-Based Care asking me if I have an update for a patient. I'll have a little look to see if I've got any meetings for the day and make sure that I am appropriately ready. So if there's anything that I need to plan or anything I need to get prepared, I've got good time to do that. My usual day, I would normally have a meeting every other week with something called Place-Based Care, which is where we try and help people to stay in their own homes. So we work with the social services team, we work with speech and language therapy, we work with district nurses, and we try and make that person's daily living at home more accessible and easier for them to manage. So that may be installing aids, that may be talking to them about befriending service. It may simply be a case of saying, look, we're here if you need us. So we will monitor them usually after they've had discharge from hospital. So they're normally elderly. But we just keep an eye on them, make sure they're okay. Then once we are happy they are settled at home, we then can discharge them from place-based care. We also meet collaboratively, the local practices, so we will have a practice managers forum meeting. We also meet as a cluster, so that's a group of practices. So for us, it's all the practices in Newport, where the senior partner and the practice manager meet up, and we will go through any projects for the year. We will probably have a presentation from an external service, so it may be somebody like audiology or frailty or speech and language therapy, where they will talk about their service, how to access it. So we have an NCM meeting, that's what they are. We also have meetings for palliative care in-house, where we will meet with the local hospice, and we also work quite closely with a team called the Health Inclusion team in Newport, because we are in a city. So Health Inclusion, they work with our vulnerable patients, so asylum seekers, refugees, homeless people, sex workers, the Romani community, because we know that those communities aren't always well targeted. So we also work with them. So they may be ringing and saying, can you organise an appointment? Or we may have palliative care contact us and say, can you change some medication for a patient? Can I speak to a doctor? Or district nurses, they may contact us and say, look, I've just been out to see somebody. They've got a bit of a weepy leg. Can we organise some antibiotics? The thing that I love most about my job is the variety. No 2 days are ever the same, ever, ever. So I have been a practice manager now for 7 years, and in all 7 years, I don't think I've had 2 days the same. To come in and not know what you're going to get every single day is, it's quite challenging, but actually it does keep you on your toes. I love the interaction with our patients. That can be really challenging as well, but to be able to sort somebody's problem out and have them walk away from the surgery feeling that they have been listened to and that they have achieved something, and feeling reassured in their care, is the best feeling in the world. We have recently taken part in something called a complex care review, where we have targeted our very elderly patients with multiple comorbidities, and we've had them in for a review. The doctors spent about an hour with each patient. They've gone through what's important to that patient. One of the big things we overlook is how important death is. So we talk to the patients about what's important to them. How do they see their end days playing out? Do they want to stay at home? Do they want to go into a hospice? We ask them whether or not they have a DNAR in place. So do they want resuscitation? And also we talk about the DNAR, which actually can be quite scary for an older person, because there's the assumption that the second they're poorly, they won't be resuscitated if anything happens. But actually that's not the case. So we talk about keeping them comfortable. And those reviews have been amazing. They've been fantastic for the surgery. They've been fantastic for the patient. We now have, next of kin details for lots of our elderly patients. We know what they want to happen as they get older and frailer, and they also know what to do when they get frailer. So at the point at which they should be going to hospital, at the point at which they should be contacting the surgery. So my career path to get to here, as I say, I've been a practice manager for 7 years. I am only educated to GCSE level, which, I'm a little bit older. So back then it wasn't such a thing to go to college and university and things. So I'm educated to GCSE level. When I had my little boy, who's now 22, I went into work in a community pharmacy. I did a couple of years in community pharmacy. I then moved from England across into Wales. And I came to community pharmacy in Wales. I then transferred and I worked in as a receptionist in a dispensing doctor's practice. So essentially, I was a receptionist, but also we dispensed medication as well there because we were a rural setting. I then became a HTA, so a healthcare assistant, and actually discovered that I really didn't enjoy sticking needles into people. It wasn't for me. So from there, I became a dispensary manager. I was then promoted to the role of assistant practice manager. And then 7 years ago, I made the leap and became a fully fledged practice manager. For me, I found actually having all that experience of different aspects of the practice has really paid dividends. When I ask a member of my team to engage with something for me, so whether it's an enhanced service, or I'm asking them how long something will take, they know that I have an understanding of what's involved in that process. So, and I think as well, it's really important. My doctors know that I have an understanding of all the processes within the practice. My advice would be to try the different roles on the way up. There's nothing wrong with coming up, through a practice. So try the different roles, see what sings to your heart. It isn't always admin that sings to you. It isn't always clinical work. For me, I'm definitely not a clinician. I much prefer the management aspect of things. A lot of my role sits around ensuring that the practice is profitable and that it's safe. So I do a lot of HR work. We do something called enhanced services. So those enhanced services make the practice money. So I make sure that actually all the work to achieve the payment for that enhanced service has been done. And I could do that without my knowledge, but actually my knowledge makes things a little bit easier for me.